So the symptoms with perimenopause and menopause are very similar.
Okay.
I will say that with perimenopause, it can be a little bit more erratic because remember I talked about those big hormone fluctuations that are occurring. But like I keep saying, there's a lot of them. So we know the common ones. We know hot flashes. We know mood swings. So let's dive into it a little bit more. So vasomotor symptoms are hot flashes, night sweats, and heart palpitations. And then there are mental cognitive symptoms. So increased depression, worsening anxiety, forgetfulness, fatigue. And then there are the genitourinary symptoms, which is vaginal dryness, painful sex, and increased urinary tract infections. And then the not so common ones are itchy ears,
Okay.
and joint pain, and constipation.
One of the things that's really interesting that I was reading about for perimenopause was all of the learning disabilities and the forgetfulness was perimenopause, but then it kind of stopped. And then in menopause, you kind of got your cognitive function back. It was just really interesting reading about that.
Yeah. And I will say that when women cross that threshold into menopause, the symptoms that I see people complain about the most is more the genitourinary ones. So the vaginal dryness, the painful sex, and then the frequent UTIs.
I'm going to be honest. When you say this list of symptoms, as a woman, I feel like a lot of women are sitting there and they're like counting on their finger how many they have, right?
Yeah.
Like, especially if you've had kids or even
Right.
if you haven't. But a lot of women can relate to having those symptoms. So how do you know that it's perimenopause and not just, you're having depression or you're having...
How you know if you're in perimenopause or menopause, I would ask your parent, your mother, when they had menopause, because that might give you a ballpark.
Okay.
I would also just pay attention to how you feel. Now, you mentioned that if you're going through the same thing in your body for so long, you'll notice a shift. You'll notice a shift. And not for everybody will have the classic symptoms. Not everybody is going to have hot flashes. Actually, a lot of women don't in perimenopause. It's more mood disturbances, fatigue. They're not getting good sleep. They feel a little bit more anxious. They feel like they're snapping at their kids more than they used to. So I would just really listen to your body. Like, when your body, something's not right. And then talk to a medical provider about it.
One of the things that's really interesting, and we've harped on this before, is when you look at your body, your cells, every single cell in your body has a certain type of receptors, right? And so you have all of these molecules floating around in your body. You've got cytokines, you got chemokines, you got hormones, all kinds of things that are just floating around, binding to their receptors, activating certain things, activating certain actions, activating the way you think, the way you move, how you act, how you respond. And when you're going through perimenopause and menopause, you have a lot of these molecules that are just no longer there, and they're affecting you in ways that you're just not used to.